நெஞ்சங்களே, அமெரிக்க வாழ் தமிழர்களே மற்றும் இந்த நிகழ்ச்சியில் கலந்து கொள்ளும் அனைத்து தமிழ் மக்களுக்கும் அன்பான வணக்கம். நமக்கெல்லாம் மிகவும் முக்கியமான தேவை உடல் நலம், உள்ள நலம். அதை நமக்கு புரியும்படி நாம் என்ன செய்ய வேண்டும் என்பதை விளக்கமாக சொல்வதற்காக சென்னை மருத்துவக் கல்லூரியிலே பயின்று, அங்கேயே மகப்பேறு மகளிர் மருத்துவம் பயின்று, இங்கே குட்டி தமிழ்நாடாக விளங்கும் வடகொரலினா மாநிலத்திலே மருத்துவராக பல ஆண்டுகளாக பணிபுரிந்து அவருடைய பயிற்சி நேரத்திலேயே பெரிய விருதுகளெல்லாம் வாங்கி மிகவும் அன்புடனும் கவலையுடனும் நோயாளிகளை கவனித்து நல்ல பெயர் பெற்று இங்கு சிறப்பாக விளங்கும் டாக்டர் சுஜாதா சஜீவன் அவர்கள் நம்முடன் கலந்து கொண்டு பேச இருக்கின்றார்கள். இதை பயன்பெற்று இந்த ஒளிப்பதிவை மற்றவர்களுக்கும் அனுப்ப வேண்டும் என்று கேட்டுக்கொள்கின்றேன். அம்மா பேசுவார்கள், பின்னர் நாம் கேள்விகளை கேட்கலாம். நிகழ்ச்சி ஆங்கிலத்தில் இருக்கும், அனைவருக்கும் புரியும்படியாக இருக்கும்படி. பின்னர் கேள்விகள் நீங்கள் எப்படி வேணாலும் கேட்கலாம். அம்மா சுருக்கமாக சொல்லுவாங்க. பின்னாடி உங்களுக்கு எதாவது வேணும்னா அதை கேள்விகளை கேளுங்க, அதுக்கு தகுந்த மாதிரி பார்த்துக்கலாம். டாக்டர் அம்மா வரலாம். சுஜாதா சஜீவன், நன்றி, வணக்கம்.
One நிமிஷம். Let me share the slides.
இல்லைம்மா, என் படத்தை எடுத்துருங்க, அவங்க படம் மட்டும் போடுங்க.
Can you see the slides, everybody?
தெரியுதுமா? We can see.
Okay. Yeah. Thank you, Dr. Soma, for the nice introduction. So yes, as Dr. Soma said, my name is Sujatha Sajeevan from Chennai, and I'm working here in Cary, North Carolina as a family medicine physician. I did.
அம்மா, உங்க வீடியோ படம் வரல, உங்க வீடியோ படம் போட முடியுமா?
Health experience also. Video போடுவா? Okay. தெரியுதுங்களா இப்போ? Okay. All right. Thank you everybody for coming this morning on a Sunday morning to attend this talk and to get some information. Actually, this was rescheduled from a couple of weeks back. I was not feeling well. I was sick. So sorry for that if you missed the couple of weeks back meeting. So the topic doctor gave to me was healthy body, healthy life. I also thought it should also be healthy mind, right? So body means mind and body together, connection. These days, there is a lot of talk about mind and body connection, where we should have more, mental health also with the physical health. That together gives us a very good, healthy life. So generally, let's see what is health. So generally, we think like health means not having any disease, right? Yes, so that is health. Of course, physical health is not having any disease. But what does the World Health Organization state? It states that health is a state of complete physical, mental, and social, right? So all the three. So we think usually only like, if you're not sick, we are healthy. So mental health also is very important. And also social health. Social health is having connections with like the society, connecting with friends, family, having that social connections is also is a complete health. Not just the disease. It also, you can state it in different ways. It includes the ability to cope with stress. So when you have stress, how we are coping with stress, right? And also feeling good about oneself. How much we are contributing to the society, right? Doing our work independently daily, feeling happy, and also enjoying the social connections. The entire holistic thing, health, is generally called as health. So why are some people healthy? Why some people are getting diseases? So a lot of factors play into why somebody is healthy, why somebody is getting diseases. So generally, of course, right, lifestyle is plays a lot of role into it. Like what we eat, our diet, our exercise, whatever substance use like people are using, The smoking, drinking, drugs, those kind of things. And what are the environmental factors? So where we are living, do we have clean air? Do we have clean water? Is, the food that we eat, is that clean? How is the conditions around us? Is it safe, unsafe? What are all the social factors? So why always higher, richer people who have higher income, they are more like healthy, right? So they have access to healthy food, better, kind of resources. They have access to health, even to go to doctors, those kind of things. So of course, income plays a huge role. So in like medicine, we read about all these social factors also. And also the educational status, right? Who are more educated, they know more about health, they are more aware as to what they're supposed to be doing, right? So education and whatever access you have. Of course, a huge part is genetics plays a huge role. If you have like genetic, predisposition, depends on whether you have good genes, bad genes. Sometimes you're doing all the right things, you're eating right, you're exercising, you're doing everything right, but still you get, diabetes or high blood pressure and those things, which are pretty common in our people. Sometimes it's just a genetic factor, especially Indian population. These things like more common, cardiovascular diseases. More and more younger people are getting heart attacks and diabetes and stuff like that. So that is mainly also genetic factor plays a role. So sometimes we cannot prevent that. We just have to do what we need to do to prevent the disease. And once the disease comes, we have to do what we need to do to keep it at a very milder, way, or to keep it well controlled. So as we talked, overall health is a multifaceted concept. It requires a holistic approach, physical, mental, social, and environmental factors. So next, as a primary care physician, we talk about how to prevent the disease, right? Prevention is better than cure. We know that saying. So before the disease comes, how to prevent? Of course, we know all those things, right? So eating healthy. So I'm going to go here. So how to avoid, you have to avoid smoking, limit your alcohol consumption, being physically active. So what does being physically active mean? Like at least 30 minutes of moderate intensity physical activity at least 5 days a week. So not just, slow walking or just moving around. So really they say at least a little fast walking, at least 30 minutes for 5 days a week. That's physical activity. And we know the stuff, right? Smoking is not good, and alcohol, kind of limit your intake and all that. And then maintaining a healthy weight. If you're going to eat healthy diet with diet rich in fruits, vegetables, whole grains, and all low fat diet, right? So then, of course, you can maintain a healthy weight by that. So generally, the diet, as you all know that, right? We need to eat a lot of vegetables, fruits, whole grains, and then reduce your fat intake. Of course, proteins. Proteins are more important as well. Then, of course, sun exposure, they say, wear that SPF creams, and, wear the cream that has the sun protection, because of you can get the skin cancers. Of course, protecting against the STDs. That's the other thing. So generally, what you have to do is every year it's good to get a preventive physical exam. That's a health maintenance exam, or we call it a physical exam. At least once a year. At least here the insurance covers once a year physical exam for all the people. So why you have to do? Some people who are younger, they don't go. Of course, women, you get your checkups when you're pregnancy, during pregnancy, and after delivery, you go to your OB/GYN, you get checkups. So at least you get some blood work done and everything. So when you're younger, they say even like if you're less than 30 or even less than 40, they say, every 2 years, at least 2 to 3 years, you can go to your physical doctor and get checked. But these days, more and more younger people are getting sick. So, getting sugar at an early age, diabetes. I'm seeing more and more Indian community patients getting diabetes, very young people, 27, 28-year-old patients are coming in with diabetes and high blood pressures and, cholesterol. Cholesterol is another issue with our population, and the triglyceride, especially in cholesterol, is pretty high. So that's the reason why you go to the doctor for annual physical. What do you do at annual physical? Talk to your doctor about your health concerns. You have any questions? Suppose you were trying to exercise last month and suddenly you felt a little chest pain. You're only like 32. you want to, actually, if it's a very severe chest pain, you have to go like right away to your doctor or to the hospital if it's very, very severe and it's lasting for a long period of time. Suppose in case you just had like a heartburn, an acid reflux or something like that, or you're not sleeping well at night, you're stressed about something, right? So those the time you can go talk to your doctor about those things. Then the other reason for an annual physical is you can get your labs done. So you can check your cholesterol, you can check where your sugar is, your liver, your kidneys, your hemoglobin, make sure you're not anemic, all those things. And then after a certain age, like, for women from 21 years, they have to do pap smears. So pap smears start at 21. So for women, it's a very important time to get the pap smear, the breast exam, all that done. And after 40 and all that, all your preventive or screening tests, the preventive test you do, those things all start, like for women, mammogram, pap smears, colonoscopies, for colon cancer screenings for everybody, for men, for the prostate cancer screening, all those things. So we can talk about all those one by one. So, in the US, there is a US Preventive Services Task Force. So that is a committee that gives the recommendations on when people need to do screening test and how often and how much, what is the duration. So generally the insurance also goes by that. So they cover whatever the US Preventive Services Task Force says, they cover those screening tests based on those recommendations. So let's start with women. So women, as I said, breast cancer screening, now they recommend starting at age 40. Of course, you can start earlier if you have a family history of breast cancer. So the most significant family history for a woman would be on the mother side. If you have your mother who had a breast cancer, or your mother's sister, like your maternal aunt or a maternal grandmother, maternal side, right? Your sister or whichever, right? Whoever had breast cancer, then you're more at high risk. Suppose your mother had a history of breast cancer at age 40. Then you start 5 years sooner. You can start breast cancer screening with mammograms at age 35. So you're more prone or at a high risk of breast cancer because of your positive family history. So women who have a positive family history of breast cancer can also get like genetic testing done. You can check for those BRCA genes. That is BRCA, we call it BRCA genes in medicine, BRCA genes 1 and 2. So that testing can be done so that it will be covered by insurance. If you tell them right to your doctor that you have a high risk or a family history of breast cancer, they can get those testing done. So some women, or you must have heard in the news, who are positive for those BRCA genetics, they get a bilateral mastectomy also. Sometimes, they remove the breast just to be safer, to prevent the breast cancer from coming. So screening, so those are the things, guideline. Those who have a family history, they can start sooner, depending on their family history. So next is breast cancer. You can have screening done every year or even once in 2 years. So every year is generally what is recommended, because more and more women are getting diagnosed with breast cancers. Actually, the latest statistics is 1 in 5 women are diagnosed with breast cancer. So there's the kind of recommending. So the US Preventive Task Force is saying every 2 years, and then the Cancer Society, the American Cancer Society, and the Radiological Society, they are saying every year. For now, the insurance, pays for every year. It covers every year. So get it done every year. Of course, even if you had a mammogram 3 months back, suddenly you have to do self-breast exams, you're feeling a lump, you have to go to your doctor right away. You have to repeat it. So don't think I just had a mammogram last month, I'm not going to, it's all fine. No, anytime you feel a lump. So there are different types of mammograms, screening mammogram, there is a diagnostic mammogram. So if you feel a lump anytime, it will become a diagnostic mammogram, and with ultrasound. And if biopsy is needed, they can do the biopsy right away and check if there is cancer cells in the lump. So it's slightly different. So anytime you feel it, you go to your doctor. So next is pap smear for women, cervical cancer screening. So that is pap smear is done for screening of the cervical cancer. So you could have to start at 21. Now the guidelines is start at 21, go on until age 65. And unless, of course, there are changes in everything. So you can do it every 3 to 5 years. If you're doing PAP with HPV, that's a high risk human papilloma virus testing. It's a HPV testing. That virus is the one which causes cervical cancer. So if you have high risk HPV virus and you tested and it is negative, pap smear is normal, you can do every 5 years. So only pap smear you can do every 3 years. So 3 to 5, they're still covering pap and HPV every 3 years. So it's good to get it done. So same thing if it is abnormal. If any time you have an abnormal pap smear, it's good to get it done. They say every year, just to make sure you don't develop the cervical cancer. So that's the same thing. Go to your doctor anytime, whether the HPV is positive or your pap is positive, or it's abnormal. You have to go to the OBGYN. They might do like a colposcopy based on, it's like low grade, squamous intraepithelial lesion. Either it's low grade, it's middle grade, or high grade. Depending on that, they will recommend whether you need a colposcopy or biopsy and those kind of things. Next is colorectal cancer screening. Colonoscopy is the test we do to screen for colon cancer, colo and rectal, of course, it's colorectal cancer screening. So before it was at 50 years, you start at 50, now they reduce the age to 45 because more and more patients are getting diagnosed with colon cancer at younger age these days. So since it's getting, coming in young people, they reduce the age of screening to 45. So you go to your doctor and then they can refer you to a gastroenterologist. So your primary physician can send you to a gastroenterologist. And the full colonoscopy, if you're cleared for that, suppose you go get a full colonoscopy and everything is cleared, it's normal, you're good for 10 years. That's how the guideline goes. And of course, if you develop any symptoms, they will always, can do it sooner also. So it's not scared to have a colonoscopy. So a lot of patients I see, especially our Indian community people, they get scared. Once I tell them, no, you need to get colonoscopy. Oh, no, I don't want to get it done. They get scared. So nothing to be scared about. They just give you a good sedation, like IV sedation. You go to sleep. You don't know anything. You don't feel anything, and it's not painful. So after 30 minutes, by 30 minutes, it's done, and you wake up. Sometimes they do both endoscopy and colonoscopy on the same visit. Endoscopy, sometimes that is called as where they put a tube down your throat, go into your food pipe, and they see inside your stomach. That's when you have symptoms of, heartburn, severe heartburn, acid reflux. Some people, they are kind of vomiting blood or things like that, something in your stomach. They see, on top also. Sometimes both are done at the same time. So they can find out if something is going on. So for people who totally don't want colonoscopy, who refuse colonoscopy, there is also like a Cologuard test. Cologuard test is a kit. It all goes through insurance, so you don't have to worry about the cost. They ship it to your house. You just have to send in stool samples, and they test it. They look for cancer cells, blood, and those things. If you're cleared in that, if everything is normal and negative in Cologuard, you're cleared for 5 years. Of course, our basic always, olden test is the stool test. You can always get your, rectal exam done, and your doctor can check the stool test for blood. And even you can do that, how you can take some stool cards from your doctor home and check it at home. So those are all the basic colonoscopy for the colorectal cancer. And of course, anytime you see blood in your stool, you have constipation, you have diarrhea consistently, you have stomach pains, a lot of acid reflux, heartburn. So you need to go to your doctor, and you can go to the gastroenterologist and get all that checked. So don't think that seeing blood in stool is normal. Yes, it can be just a common thing like, hemorrhoids or something, but you want to go get it checked to make sure, because one common symptom or sign of colon cancer is blood in stool. So we have to go get that checked. So that's about the colonoscopy. Of course, prostate cancer is for men. So that starts at 50 age in just average risk individuals who don't have a family history of prostate cancer. You can do a PSA, of course, a rectal exam during a physical with your doctor. And if you're at high risk of prostate cancer, like you have a family history, your dad, brother, uncle, somebody, grandfather somebody had prostate cancer, you start your PSA screening at age 40 to 45, and then they say like stop at 70. There's no point in keep on testing, as you get, older. And then prostate cancer is a very slow growing cancer. So all these screening tests we're talking, right? So it's good to kind of detect cancer early, but they also warn against, an unnecessary testing, unnecessary biopsies. They don't want to create a panic in the population. So that's something also we need to think about. And all these tests also, it changes, as I said, in cancer, even though everybody, they said it's 45. If you have a family who had a colon cancer at say 45 or even at 42, you need to screen much earlier, at least 5 to 7 years earlier. You have to get a colonoscopy even by 40. So all these guidelines changes. This is just a guideline, as I said. Things change depending on your symptoms, depending on what your doctor recommends. That's based on your family history, your genetics, all those things. There's actually multiple factors play in it. Okay, so main thing is all this you can talk with your doctors. Doctor, when you go for the physical, these are all to preventive. These are called as preventive test or screening test. That's before some symptom comes. So don't wait till any symptom comes. Tell that, oh, I'm going to wait for anything. I'm fine. Some of the patients, they don't understand what is preventive test or what is screening test. Screening is before symptoms happen. And they come and I tell them, no, you need to do this. It's like, oh, I'm fine, doctor. I don't have any symptoms. I'm feeling good. So this is when before any symptoms come, before you get a blood in your stool or stomach pains or, cervical cancer, or for women, breast cancers, those kind of things. One more thing also for lung cancer, for those whose smoking history, nowadays, especially Medicare has approved this annual CT scan of the lung. It's a low dose CT scan. You can get that lung for those people who's had smoking history. And for osteoporosis, it's a bone density test. Generally, they do it for like women because women lose calcium in pregnancy and breastfeeding and all those things. So it's for all women greater than 65 years, or if you're less than 65 years with risk factors for osteoporosis, right? Suppose you have low calcium, or you have taking steroids, like long-term steroids for any autoimmune disease, things like that. So though you're more prone for osteoporosis. And also, of course, men with risk factors, who have hypogonadism and those kind of things. The same thing, like if they're on long-term steroids and all that, risk factors for fracture, you can get a bone density test done. So next is, of course, cardiovascular disease prevention. So heart disease, right? So it's very common these days, especially our South Asian community, Indian population, they are getting younger patients are dying with like heart attacks. Suddenly they're passing out, falling, even high profile people. They are all, fitness people, they're exercising and really fit, but suddenly they are dying with heart attacks. So that thing is very important. So we doctors, we do like a scoring called as ASCVD score. It's a atherosclerotic cardiovascular disease scoring. So based on your age, your family history, your cholesterol levels, whether you have diabetes, whether you have high pressure, all those things, whether you have high cholesterol, and everything plays a role in this. Of course, again, the same thing talked about in the beginning, diet, exercise plays a huge role. So try to avoid fried foods. So a lot of times we like all the fried snacks. Sometimes it's okay. So I tell my patients, I don't say like, no, you cannot eat, right? So we cannot live like that. So especially if they're a young patient, they're just 35. You can't tell them we cannot eat samosas for the rest of your life, right? So those things I try to tell them. It's like, eat everything in like moderation. So that's the key here. It's moderation. Sometimes you can eat for, just so that your mind doesn't crave so much and then you go and eat so much, right? So diet is important. We know everything. What is healthy diet? Of course, again, you have to do the physical activity and don't smoke and control your blood pressures. If you have high blood pressure, control your diabetes. If you have diabetes, and of course, cholesterol, need to control the cholesterol and everything. So diabetes, just a few points because it's very common in our people. A lot of genetic factors play a role in this. So a lot of people are like, oh, I got diabetes. So nothing wrong if you get diabetes, because if it's a genetic factor, if you have a family history, sometimes it just kinds of, how much ever you're doing like physical activity and eating healthy, sometimes you just get it, it just comes. So that's okay. You just have to keep it under good control. So really cutting your carbohydrates, right? So we eat a lot of rice, South Indian or Tamil people, everybody. So that's not very good, especially for people with diabetes. And even generally, I think even as children, even when our children are raising or growing up, better to, tell them like, to kind of limit the rice. So main thing, I think nowadays the dietitians, all the nutritionists are recommending a lot of vegetables with protein. So fill your plate with vegetables, half the plate they're saying vegetables, like, almost. And then protein. Of course, vegetarian, there are vegetarian sources of protein, non-vegetarian sources of protein. So vegetarian sources, we know all our lentils, our beans, our legumes, everything, all those things, we can eat dal, everything. And then of course you can do like all those chana, the chickpeas, green gram dal and everything. Non-vegetarian is we have to do the lean meat. Lean meat is chicken and fish, like seafood. So try to avoid the red meat. Right, goat, lamb, beef, pork, all that we can avoid. And even that we can cook like, try not to fry. So try to avoid the fried chicken, fried fish. We can do more like curries or, just grill or put in the air fryer. So these days we have air fryer. So those things, small things, right? So mainly protein. So try to increase like the protein in your diet. So it keeps you filled up. You don't get very much hungry. Suppose in those days, right, we used to almost fill half the plate with rice. And then eating rice and little vegetable and stuff, and you go, right? Just suppose you're putting dal, sambar, rice, and vegetable. After 1 hour, we're feeling hungry. And of course, the carbohydrates makes you tired, right? You get the sugar slump, can make you hungry. So if you eat more vegetables and then protein and little rice, of course, you need carbs. Your body need carbs and sugar. A little bit of carbs is fine. Some rice and some, you want to do some bread, like make sure it's all like whole grain with fiber, multigrain. So brown rice, quinoa, millets, ragi, those kind of things. Go with the small grains, they say these days. So those kind of things helps. Of course, with hypertension, for hypertension, same thing. I've seen many, many young patients coming in with high blood pressure. So again, it's a huge family history. Of course, bad diet and lifestyle plays a role in all these things. So I tell them, right? So main thing is the low salt diet. For blood pressures, first thing you can do, even though suppose you're telling I'm only 35, it's just borderline, my blood pressure is like 140, 142, sometimes like that, and border, lower value is 90. So start with a low fat diet. I mean, sorry, low salt. Of course, low fat also helps, but main thing for a blood pressure is salt. Low salt, low fat diet, and start exercising and stuff. That's a huge factor which helps with the blood pressures. Same thing with the cholesterol, right? So sometimes it's just totally family history. I see a lot of patients who are totally healthy, eating only salad, and still their triglycerides is high, the LDL is high. So cholesterol has, right? So you guys should know, because I'm sure you're all going to your doctors and getting your physicals done. So cholesterol is broken down into LDL, HDL, and the triglycerides. LDL is the cholesterol, which is protective for your heart. Um, cholesterol, which comes from carbohydrates. So the more you reduce your carbohydrates, your triglycerides comes down. That comes from carbohydrates, sugars, and sweets. So that's the triglyceride. You can reduce that. How do you reduce? The other way you can reduce your triglycerides is increase your intake of fish, nuts, avocados, olives, olive oil, all they say has good fat, right? Those things. Of course, you can take supplements, fish oil capsules, omega-3. So those who don't take fish, vegetarians, you have even vegetarian sources like flaxseed oil, those kind of things. That reduces your triglycerides, increases your HDL. So HDL is a good cholesterol that is protective for your heart. So you need to increase the HDL. So again, that's where the seafood comes to into role. It plays a role where you have to increase the seafood. The fish contains a lot of good cholesterol, the HDL, that is protective for your heart. So those things, and of course the LDL is the bad cholesterol. That's all your fried, stuff, your fatty red meat, desserts, your potato chips, pizzas and whatnot. We know all what the bad stuff is. So as I said, again I say, everything is, if you want to eat, you have a birthday celebration and you want to eat a, slice of cake, fine. But just make sure you're not eating like a quarter piece of the cake, take a small slice and then just go try to do something about it. If you want to go for a walk after that, fine, go ahead and walk. So you can try to burn it off. So for cardiovascular disease, so for the heart attack prevention, you can do all these things, right? So these are the things you do. And then even if you have any chest pain or anything, you can go to your doctor, get some EKG done. If you want further testing, you can go to the cardiologist, so they do the stress test, right? They make you do the exercise treadmill test that detects if you have any blockage in your heart. So one is the exercise treadmill. That is the most common basic test. You can do a stress echocardiogram. There is also now they do the coronary artery calcium scoring. So inside, like the artery that supplies the blood to your heart, that is the coronary calcium scoring. It's a small scan. I don't think it's covered by the insurance, but it's like $100 or something. You can pay out of pocket and get it done. It shows how much calcium is there. So that is the ones which causes the blockage in the future. So the more higher calcium score, they say it can have more risk of the heart attacks or blockage. So once your artery to your blood flow to your heart is blocked, that is when you get the chest pain and you get the heart attacks. So go to the hospital if the pain is severe and you think it's not right. They may check you out and say there is nothing, it's fine, but it's good to get it checked. So don't think it's nothing. Maybe it's just an acid reflux, just heartburn. I'm just going to wait it out, or I'm going to go to my doctor tomorrow. It's fine if it's just mild and it's nothing, it's a heartburn. But if it is severe, or even if it is mild, if it's the first time, it's good to go and get it checked if it is after hours or if it is on a weekend. Next is, of course, we talked about all the physical health and screening for all our physical diseases. What about psychological health, psychosocial screening, right? So what about a psychological health? So that is most important these days. And, the lifestyle, Western lifestyle and everything. And we moved from a different country to here and we are living, sometimes alone without family. So, and then we are constantly working. Of course, like we don't have help here at home to do our household chores like back home in India. So everybody's getting stressed. I see more and more patients, coming in really stressed, especially women. They have the burden of nowadays, all the women are also working. Everybody's saying I'm IT. Then so doing IT job is very stressful. It's not easy. And then coming home, they have little kids, kids taking care of household chores, everything. So you can do that. They can come to the doctors. We do the screening test. I just give them a paper to score. So it's either PHQ2, PHQ. So if they positive, test positive to see if they're depressed. So for depression, it's PHQ2 scoring. You can actually Google it and find it online, and you can even self-score yourselves if you want to see, whether you have anxiety, whether you have depression. So if those two questions, it's just a couple of questions. If those two questions are positive, we move on to PHQ9. So that has a total of 9 questions. Same thing with anxiety. It's a GAD-7, general anxiety disorder. There's 7 questions. We give that to the patients, and based on how they score, we can tell, whether they have more mild anxiety, moderate anxiety, severe anxiety. So based on if they test positive, if it is mild, of course, they can just go to therapists. They can talk to therapy, so that's one thing I also, and encourage more of our patients to do. If they have a lot of stress, nothing wrong with talking to a therapist. A lot of people like, no, I don't want to go. Sometimes they teach you strategies, how the coping skills. As the first slide I told you, you need to have ways to cope with stress. So they teach you if you're stressed, what to do. They teach about deep breathing, the meditations, a lot of things we can do, right? When we have anxiety, just small things like, back home we learned deep breathing, the meditation, the yoga, prayer. Whoever prays can pray. Whoever wants to, just do meditation can do meditation. Then just music, listening to music, going for a walk, doing physical activity every day. That helps with your mental health as well. Calling, talking to family and friends, having a social circle, that of course helps. So those are the things also you can get done in your physical exam, or, anytime you're feeling stressed or anything, go to your doctor and tell them I'm feeling stressed and, I'm not able to function. So things, the other signs that shows you're stressed, that you're not able to sleep. A lot of patients tell me, I'm not able to sleep, doctor. I keep thinking about, so many things in the night, the work stress, the family stress, or whatever is going on, right? So that's one thing. So sleep is so important. Sleep is such a magical pill. I tell the patients it's magic. Once you get sleep, it's almost like you took a pill or something. You sleep for 8 hours every night. You're supposed to sleep for 8. They kind of recommend. I don't know how many of us are getting 8 every day. Even me, I don't get, so much sleep. Sometimes I get less. I try to catch up on days off or on weekends off. Sometimes I have to go to the hospital on weekends. So sometimes many days I'm not sleeping well, but then I try to, catch up, or even on like a weekend I'm off, I just take a little nap. So we need to get the enough sleep every day, the 8 hours. The next day you feel fresh, refreshed, you're calm. It's a whole new day. And sometimes things which were stressing you out the previous days, you're feeling, much, much better the next day. And of course, the usual things we talked about, the tobacco, the alcohol, the drugs, those things you can talk about with a doctor. They go over that with a preventive test. For alcohol use, there's another scale we use, a screening test like Audit C scoring, as to, how much you're drinking, how much you drank last time, or how often you drink, and those kind of things. So you'll know if you're at risk of going into, drinking problems. So those things you have to be very careful. Just to, keep it minimal, or even don't drink. It's good, right? So once you start drinking, you just don't know what is kind of like a healthy range and stuff like that. And of course, drugs is a totally no drugs, right? So smoking also, we totally tell them not to smoke, totally quit smoking. And drugs, and then safety at home, you can discuss that, especially for like pediatrics. We talk about gun safety, we talk about, seat belts, we talk about helmets while riding a bike. And, adults, we talk about domestic violence and the safety at home. So those things. And of course, all these vaccinations you can talk about. So flu vaccine, influenza vaccine is annually once a year. Tdap, that's for tetanus, diphtheria, pertussis vaccine is once every 10 years, or anytime you don't know when you got your Tdap, but you kind of poked yourself with a nail, with a rusty nail, or you had a cut, you fell somewhere, that's when you get your tetanus Tdap. And then the HPV, it was from 9 to 14 years, but now they extended to 45. So women, younger women especially, who haven't had a HPV vaccine when you were younger because it wasn't available at that time, can go to your doctor and you can get it. And asking for the HPV vaccine, even if they're 30, 35, because your insurance now covers for women, men also. As like, it's not just for women, it's for men also till 45. So it's for boys and girls, same way it's for men and women. For men, it's more to prevent your cancer of your penis, genital warts, and all those things. For women, of course, it prevents cervical cancer. Same thing, warts and other stuff. Shingles vaccine is after 50 years. So once you reach 50 years, you have to get shingles vaccine. It's a 2-dose vaccine. The first dose and second dose is after 6 months. That prevents shingles. So even if someone hasn't had that vaccine, you get shingles, you can still get it. So, but just wait till the shingles kind of goes away, give it at least 6 months time for your body to act and all that, and then you can get the shingles vaccine, because it prevents getting it again, or even if you get it, the symptoms are mild. Then the pneumococcal vaccine is for all adults more than 65 years. So once you reach 65, when you get your Medicare, remember to take your pneumonia vaccine. And if you have risk factors, you can even get it sooner, between 50 to 64 years of age. If you have diabetes, and if you have COPD, if you have asthma, if you have lung disease, you can get it sooner. COVID vaccine, we know that, there's an updated booster recently, because it keeps changing. The virus keeps, kind of mutating. So it's good to get the updated booster for the 25 year. And now they have the RSV vaccine, because RSV was very high last year. So For high-risk adults, more than 60 years. So it's the same thing. After 60 years, it's for high risk, and everybody after 75. So it's really for older people, elderly people to get these vaccines. Okay, I think I'm done. Sorry, I think I went beyond the time limit. If you have any questions, you can ask.
Thank you. Thank you very much, Doctor. In
Thank
a
you,
short
sir.
time, you have covered completely everything from prevention to vaccination. It's fantastic. We really appreciate your help. Thank you very much. I'm glad, you were able to do this. And please, friends, Ilamaran, can you make Mohan as a co-host? Mohan, can you share and show some pictures? And friends, this will be in YouTube. Ilamaran, post the YouTube link to everybody. Please forward this to your family and friends. It's very important. This is not just for us. It has to go to all our friends. Very, very important that we help as many people as possible. That's the focus. I really appreciate what she has done. In this day and age, nobody should die suddenly. As far as possible, nobody should die suddenly. The sudden death, very few, only 3 things causes sudden death. One of the most important thing is the coronary artery disease, heart attack. It doesn't happen overnight. From the first picture to the last picture of, the blockage, it happens over years. Some people with the history, they should start with 30 years, 40 years, do doctor said stress treadmill test. Next picture. See, there are important arteries supplying the heart. More next picture. They get blocked up, and that's why you get a heart attack. In arms and legs, they have some arteries, additional arteries that supply, so you don't get any complete blockage. But in the heart, only the 2 main arteries, right and left, and their branches. So they get clogged. That's why completely you get a heart attack. Heart attack is most of the time totally preventable if you take care, like doctor said, and do a stress EKG test, treadmill EKG test. Only after 80% of blockage, you get symptoms. Until 80%, you don't have any symptoms whatsoever. You can run a mile, you can run 5 miles, nothing will happen. After 80%, suddenly something comes and blocks, or clot will block, and 100%. That's when you get a heart attack. So the 80% deletion and all, sometimes you can find it with the treadmill test. So that is why it is very important. Okay, next topic. Very, very important. Tamil Nadu is drowning. I don't mean simply, I mean very strongly. Thambi, next picture. Tamil Nadu is drowning in what? Thambi, the next picture.
It is drowning in alcohol.
Yes, yeah, he got it. What is alcohol doing to us? This is normal liver. The liver down is cirrhosis. How long does it take? 20 years, 25 years. But if you catch it early, the liver can heal itself. You can take 2/3 of the liver, and a person can live with 1/3 of the liver rest of the life. So 80% of the liver has to be damaged before you get any symptoms. That is very important. So we can stop at any time and help those people. This is very, very important. And now recently, Ayya Mahendran of the Communist Party, he has started a movement all over Tamil Nadu to make a big push to stop drinking. Nowadays, I understand, high school kids are having parties, and that is drug and alcohol. Very sad situation. This is a social problem. We all have to do our best. Next, Thambi. The other important thing is to prevent cancer. A lot of cancers can be prevented or diagnosed early and taken care of. Amma sonanga, breast cancer is very, very important. Everybody should learn self-examination. Everybody should do it at least once a month. A small nodule can be cured completely. We should not see anybody dying of breast cancer this day and age. Next is colon cancer. This colon cancer develops over years, 5 years, 10 years, it takes that long. So if you have a colonoscopy every 3 to 5 years, you will completely cure colon cancer. This is what is called a polyp. The cancer starts like a polyp. The polyp can be removed with a wire, burn it, take it out. This will not become a cancer. Next picture. If you let it go in the next 2-3 years, or 5 years, next picture, it will become cancer. The stool occult blood. They check for blood in the stool. This is always little blood that comes out. We cannot see it, but the stool test will show there is blood. If that is positive, you should have a colonoscopy done and taken care of. So these are common things. Amma, I want you to talk about autism for a few minutes, if you don't mind, because that's a big problem and everybody wants to hide it. They don't want to face it. Please say a few words about that. And then I request all of you to ask questions, and then we will appreciate very much your input. Thank you. Sujatha, solunga about
Yeah.
autism.
Autism. Okay. So autism spectrum, as doctor said, Sir Sonamari, it's increasing in the prevalence. So I don't know the exact, I didn't look at the exact statistics, but I know it has increased recently in the last few years. So especially women who are having, young children, more and more children, I don't know what are the reasons. So they say one reason it's increasing is because of increased testing and diagnosis. Second, of course, a lot of electronics and all the stuff that also is not good for the children these days. So one main, characteristic you can see is children when they are younger is, you can see how their social interaction is, if they are maintaining eye contact, if they are smiling at you, of course, the speech, right? So the most important thing, they have a speech delay, or they don't have words coming out as the time as they're supposed to be talking. By 1 year they're supposed to be saying at least dada, mama, like 2-3 few words. So those things, so you have to go to the pediatrician, and every well child check, whenever you go for the children's physical, you have to do the screening test. Around 18 months there is an MCHAT screening, it's called as, which the doctors give you to score, to see whether the children is developing. Normally they are talking, are they, waving, they're saying mama, dada, and those social skills. So nothing wrong about it, and a lot of people don't want to get the testing, or they don't want to get the diagnosis. So the one good thing, if you get the testing and get the diagnosis, they can get the services they need, they get the help they need. So if they get the, more, the therapy needs to be started as soon as possible. So the speech therapy, the physical therapy, or the occupational therapy the child needs, the more sooner you start, it's better for them, because they have better outcomes the more sooner all these therapies are started. They just need some extra help. And as you know, autism is a spectrum. So it can range from totally non-verbal to totally, high functioning people. So, these days, a lot of recent people we have heard, high level people are all, they're coming on the autism spectrum. Even Bill Gates, they say, Elon Musk, they say. So they're all very intelligent people. So it doesn't mean if they say autism, it's bad. Sometimes very high functioning people are also coming on the spectrum. They just lack some social skills. So just they need a little therapy, they need a little support, they need a little push, and then they can function, in the society. They can have a job, they can work as regular members of they can function as like members of the society. So that's something which people should not be ashamed of. And, talk to your doctor, get the testing, and get the support and help your child needs.
Thank you. Thank you very much. Anybody has any question, please ask. Sarah,
Yeah.
you have any comments?
It's a very good summary. It's an excellent summary of all the things we need to take care of. Thank you very much, Dr. Ilangovan and Dr. Sujatha Sajeevan,
Thank you.
for this wonderful opportunity for all of us to learn a lot of things. Thank you so much.
Welcome.
Number one, we have to take care of young people like me and Dr. Charan. We should not fall down. That is the main thing. We have to be very, very careful. We all have personal experience, both of us. So
Right.
you guys better make sure don't fall down. If you fall down, you will definitely break something. Okay, Sarah.
Yeah, thank you, Dr. You were very, very comprehensive. They covered all the fields, and including autism. And one thing I'm distressed is people suffer in silence. Like they have anxiety, they have depression, they have schizophrenia, and all those things. And children, they push the children to the limit to succeed, loading them with all kinds of activities and no time to relax. And it's happening all the time. People have to be aware of the psychological issues which come out of that. And so I am a part of NAMI. It's a big support group, and also Autism Society support group. I see so many people, thousands of them are suffering. Those who find a way to these support groups, they make a big difference in their life and as well as their loved ones. So I just want to ask them to become more aware of these supports available and help themselves and their own loved ones. Thank you, Doctor. You made a big difference in today's, like 10 people showed up, but I'm sure many people will be hearing through the YouTube, thanks to the media. It's going all over the world. And if you can make one Tamil one, also would be very much appreciated. Thank you, Doctor.
Yeah.
Okay.
Yeah, thank you for having me, sir, doctor. Thank you for having me and giving me this opportunity, to educate the people.
Yeah, I do agree with Dr. Saroja. You should make one in Tamil.
Vanakkam,
Yeah.
Sujatha. Dr. Sujatha, thank you so much. You covered everything. So, thank you so much for coming and giving us. Yeah.
Okay.
So, what we have to do or what we should not do, and everything you covered. So, nice speech. Thank you for your valuable time. Thank you.
That's okay. Thank you very much for coming.
Thank you, Ma. This is the other Sujatha, big social worker in North Carolina, in Cary area. Thank you very much.
Thank you. Thank you, Aya.
Bala Saminathan, வாங்க பாலா.
வணக்கம். கேட்டுட்டு தான் இருக்கிறேன். நான் உங்களோட டிப்ஸ்லாம் ரொம்ப சிறப்பாக இருந்ததுங்க டாக்டர் சுஜாதா. ரொம்ப மகிழ்ச்சி, ரொம்ப நன்றி. குறிப்பாக எந்தெந்த நேரத்துல எந்தெந்த ஸ்கிரீனிங் பண்ணணும்னு நான் குறிப்பா எனக்கு தெரிந்து கொள்ள வேண்டியது அப்படின்னு கேட்டுக்கிட்டு இருந்தேன் நான். ஆனா இதெல்லாம் அந்த கேன்சர் ஸ்கிரீனிங் டெஸ்ட்லாம் நம்ம போய் தான் பார்க்கணும் இந்த ஏஜ்ல அப்படிங்கிற மாதிரி போட்டிருந்தீங்க. அறிகுறிகள் என்ன மாதிரி வந்ததுனாக்க நம்ம போகணும் அப்படிங்கிற மாதிரி இருக்குல்ல, சும்மா போயிட்டு இருக்க முடியாதுல்ல. இதுக்கு ஒவ்வொரு ஆண்டும் போய் நம்ம கோலரெக்டல் கேன்சருக்கும், ஒவ்வொரு ஆண்டும் லங் கேன்சருக்கும், ஒவ்வொரு ஆண்டும் எல்லாத்துக்கும் ஒவ்வொரு ஆண்டும் பண்ணிட்டு இருக்க முடியாதுல்ல. என்ன அறிகுறிகள் வந்ததுன்னா நம்ம போய் பண்ண வேண்டியிருக்கும் அப்படிங்கிறதையும் நீங்க வெப்சைட்ல ஏதாவது வச்சிருந்தீங்கன்னா அந்த இணையதளத்தை கொடுத்தீங்கன்னா கூட நல்லா இருக்கும்.
So இதெல்லாம் வந்து ஸ்கிரீனிங் டெஸ்ட்டுங்க. ஸ்கிரீனிங் இன் த சென்ஸ் ப்ரிவென்டிவ் டெஸ்ட் பிஃபோர் சிம்டம்ஸ் வரதுக்கு முன்னாடி பண்றது. எவ்ரி இயர் நீங்க போறது டாக்டர் கிட்ட வந்து யூ கெட்டிங் யுவர் ஃபாஸ்டிங் லேப்ஸ், பிசிக்கல் ஃபுல் செக்அப். அதுதான் டாக்கிங் அபவுட் எனி கன்சர்ன்ஸ். ஸோ ஒரு முறை நீங்க பண்ணீங்கன்னா, இப்போ கொலனோஸ்கோபி எல்லாம் ஒரு தடவை பண்ணி ஃபுல்லி கிளியர்ட்னா தே சேயிங் இட்ஸ் யூ கிளியர்ட் ஃபார் 10 years. ஸோ எவ்ரி இயர் நீங்க போய் அதை பண்ணணும்னு தேவையில்ல. once பண்ணிட்டீங்கன்னா உங்க gastroenterologist will tell you you're cleared for 10 years. If they don't find any polyps, nothing is there, they say you're good for 10 years. So every year நீங்க போறது உங்க primary care physician, family doctorன்னு சொல்லுவோம் இல்லையா, primary care, அவங்க கிட்ட போய் physical பண்றது தான் every year பண்றது. அது வந்து நீங்க full examination, blood work, talking about any concerns you have, any questions, அதுதான் அந்த டைம்ல டாக் பண்றது. பிளஸ் your screening test அப்போ பேசுவோம். எவ்ரி டெஸ்ட் வந்து எவ்ரி இயர் பண்ணக்கூடாது. ஒன்லி ஃபார் விமென்க்கு மேமோகிராம் எவ்ரி இயர் அந்த மாதிரி இருக்கும். பட் ஜென்ரலி ஆஃப்கோர்ஸ் அதர் டெஸ்ட் ஆஃப்கோர்ஸ் பிஎஸ்ஏ பண்ணலாம். ப்ராஸ்டேட் ஆன்டிஜனுக்கு அது ரெக்டல் எக்ஸாம் பண்ணலாம் எவ்ரி இயர். பிளஸ் யூ கேன் ஆட் அ பிஎஸ்ஏ இந்த பிளட் ஒர்க் எவ்ரி இயர். அது தவிர பிளட் ஒர்க்ல வந்துடும் உங்களுக்கு பிஎஸ்ஏ. மற்றதெல்லாம் வந்து உங்களுக்கு colonoscopy is once in 10 years. Bone density, if it is normal, is once in 5 years. There's no osteoporosis. Now, if you have osteopenia or borderline low bone, that's once in 2 years. Pap smear, as I said, is once in 3 to 5 years. So, every year, except generally, as I said, PSA and mammogram, they recommend every year. Other than that, it's stretched out like 3 years, 5 years, 10 years, and they stretch it out.
அறிகுறிகள் வர்றதெல்லாம் நம்ம அப்பா காலத்தோட முடிஞ்சு போச்சு. இப்பெல்லாம் அறிகுறிகள்லாம் வெயிட் பண்றது கிடையாது. இட்ஸ் கால்ட் ஸ்கிரீனிங் டெஸ்ட்.
ஆமா, இல்ல ஸ்கிரீனிங் டெஸ்ட் ஒரு தடவை எடுத்துட்டாங்க. 50 வயசு ஆனோனே ஒரு தடவை எடுத்துட்டாங்க.
ஆமா,
திரும்ப எப்ப எடுக்கிறதுன்னு
பாருங்க. சில டெஸ்ட் பிஎஸ்ஏ, ஸ்டூல் அக்கல் பிளட், பிரஸ்ட் கேன்சர், இது மேமோகிராம், இதெல்லாம் வருஷம் செய்யணும். சில இதெல்லாம் வந்து அம்மா சொன்ன மாதிரி கோலனாஸ்கோபி எல்லாம் எவ்ரி 5 to 10 years பாலிப் இருக்கா இல்லையாங்கிறத பொறுத்து இருக்கு. அந்த மாதிரி எல்லாமே ஸ்கிரீனிங்.
சரி சரி.
கான்செப்ட் ஆஃப் வெயிட்டிங் ஃபார் சிம்டம்ஸ் இஸ் கான் ஃபார் எவர். யூ டோன்ட் வெயிட் ஃபார் சிம்டம்ஸ். இஃப் யூ வெயிட் ஃபார் சிம்டம்ஸ் யூ ஆர் டெட், கான், பை பை.
சரி சரி.
வெரி இம்பார்ட்டன்ட் ஸ்கிரீனிங், முக்கியமான வார்த்தை. ஸோ we all have to do the screening. வர்றதுக்கு முன்னாடியே கண்டுபிடிச்சு வராமல் ப்ரிவென்ட் பண்ணணும். இப்போ டயபெட்டிஸ் எல்லாம் யூ கேன் ப்ரிவென்ட், யூ கேன் போஸ்ட்போன். ஒழுங்காக டயட் பார்த்து எக்ஸசைஸ் பண்ணோம்னா we can postpone 5 years 10 years போஸ்ட்போன் பண்ணலாம். என்னம்மா ரைட்டா?
கரெக்ட் சார், கரெக்ட் சார். அப்படியே இது நிறைய பேத்துக்கு பார்டர் லைன்ல அப்படியே இருக்கும். யூ கேன் போஸ்ட்போன் இட். அஃப்கோர்ஸ் சிம்டம் வந்தாலும் போகணும், அது ஞாபகம் வச்சுக்கோங்க. சிம்டம்ஸ் இருந்தால் டெஃபினட்டா நீங்க போவீங்க.
உடனே போகணும். டோன்ட் வெயிட் ஃபார் 2 days.
கொஞ்சம் இந்த பேன்க்ரியாட்டிக் கேன்சரை பத்தி கொஞ்சம் சொல்லிருங்க. ஸ்டீவ் ஜாப்ஸ் போயிட்டாரு, அவ்வளோ ரிச், அவரு இன்ஃபர்மேட்டிவ் பர்சன். அவரு யூனோ அவரு அந்த கார்டினல் சிகாகோ அந்த பேன்க்ரியாஸை கொண்டு போயிடுச்சு அவங்கள. ஸோ அதை கொஞ்சம் சொல்லுங்க.
So right now they don't have any screening test for pancreatic cancer. Sir, நீங்க gastroenterologist, உங்களுக்கும் தெரியும் இல்லையா? You know better for pancreatic cancer.
Only way you find out is ஏதாவது சிடி ஸ்கேன் பண்ணி இன்சிடென்டெல்லாம் இப்போ கண்டுபிடிச்சாதான். இல்லைன்னா யூ cannot find early diagnosis, not yet. They are working on all kind of antigen and this and that, but it's not available yet. So that is one thing, you know, you had a CAT scan, you cannot do CAT scan on everybody. ஏதாவது பண்ணப்போ வந்துச்சுன்னா அப்போ கண்டுபிடிச்சாதான், இல்லைன்னா கண்டுபிடிக்க முடியாது.
சிம்டம்ஸ் இருந்தா போடுங்க. அப்புறம் ஃபேமிலி ஹிஸ்டரி, இஃப் யூ ஹேவ் அ ஃபேமிலி ஹிஸ்டரி, ஆஃப் கோர்ஸ் அப்பாக்கு pancreatic cancer இருந்திருக்கு, பிரதருக்கு இருந்திருக்கு, அந்த மாதிரினா யூ கேன் ஹேவ் அ மோர் focused testing or more vigilant, like கொஞ்சம் stomach pain வந்தாலே you can go at least start with an ultrasound or something like that.
Also ovarian cancer, you know, அத பத்தி கொஞ்சம் சொல்லிருங்க
சார். நீங்க சொல்றீங்களா pancreatic cancer? வேற என்ன சொல்றீங்க சார்?
ovarian cancer.
இல்ல சார், ஏதோ pancreatic cancer நான் பேசிட்டு இருக்கேன்.
இல்ல அவ்வளவுதான் சொல்லுங்க. ovarian cancer, அது
ovarian cancer also the same thing, you know, there is no screening test as of now for the ovarian cancer. You cannot keep doing CT scan or ultrasound for everybody. Same thing, we look for family history. If mother or sister, especially maternal side, maternal history, there is a positive ovarian cancer or anything, then if they even come with some mild pain or something, I just order an ultrasound, at least look at the size of the ovaries, make sure there is no like a mass or growth or cyst or anything. So same thing like a pancreatic cancer. Dr. Saroja, it's a good question, because pancreatic cancer and the ovarian cancer, we don't have any screening test as of now. So that's a little tricky. So we have to watch out for signs and symptoms and factor in the family history.
Thank you.
And one more thing, so urinary tract infection in elderly, especially women, is so common. அதுக்கு வந்து ஏதாவது சொல்லுங்க கொஞ்சம்.
Yeah, so a lot of women don't even have any symptoms. Since I work at the hospital also, sometimes they come in with just, you know, altered mental status. They're just confused. That's all. The only symptom they come in with confusion. நிறைய பேர் வந்து from the nursing homes and stuff, they bring them, you know, ambulance brings them, they were confused, they're talking out of their head. Lot of elderly women, it's a good point that doctor asked, because they have a urinary tract infection. So when we check the urine, it's very common, especially with women, elderly women. And you check the urine, they have UTI. Once you treat the UTI, give them antibiotics, they're fine, they wake up next day, all the confusion is gone. So that's something you need to keep in mind. If you have elderly parents at home, or you know, we are also getting, you know, slowly getting an elderly. So if you feel like your spouse or somebody is a little confused that morning and talking out of their head or something, or also one more thing I saw with UTI, they have falls. So நிறைய பேர் வந்து காலையில எழுந்தாங்க, இது வந்து விழுந்துட்டாங்க அப்படின்வாங்க. So they get weak or they fall, confusion, all that shows UTI. So that's something we need to think always and run a urine analysis. Even though they won't be complaining of burning urination or lower abdominal pain or anything, or frequency or anything. Once we do the urine, we can tell they have UTI, you treat them in antibiotics, they get better. So some of them get recurrent UTIs multiple times. We put them on like a prophylactic antibiotic, sometimes once a day, antibiotic, a small dose to prevent UTIs.
Thank you.
Sujatha, I have a question.
Yes, sir.
For this urinary tract problem, do you suggest TURP or just take Avodart?
So you're talking about men prostate issues? Yeah, because TURP is for prostate. So some men have like benign enlargement of prostate, we call it. Of course, prostate cancer, that's a whole different thing. So a lot of men, as they get older, they get urinary problems, like, difficulty starting the urinary stream. Also in incomplete emptying of the bladder. They feel like they finished passing the urine, they come, and then they feel like there is urine in the bladder. So all those things, it's because of prostate issues. So what happens as you get older, the prostate can get enlarged. So prostate is very close to your urinary tract. So it kind of presses on your bladder, and that's what causes all these symptoms. Yes, if it is huge and you have urinary symptoms, of course you can start with there are like medications for that, for prostate issues. If that's not working, yes, if it's enlarged and it's a big issue, then yes, if you go to see the urologist, if they recommend the TURP, you can get it done. It's a small procedure.
First try medicine, and if it is not working, then you go for TUR. அடுத்து மணிவண்ணன் வாங்க.
வணக்கம் மேடம். வணக்கம் டாக்டர். Thank you for giving a great opportunity for listening about the health issues. I have two questions. One is, I spoke with the cardiologist doctor in India. He asked me to go for coronary calcium score MRI scan, and I'm trying to talk to my doctor here, and then they're not, insurance is not covered or anything like that. So do we need to do that, the coronary calcium score, because that's, very important test for to understand the heart diseases or anything in future or anything. So they advised me to do that. If I go to India, I can able to do that. But however, here their insurance is not covered. So can you able to give me a little bit elaborate information about coronary calcium score?
Yes, so yes, that's correct. Insurance doesn't cover, but both wake radiology, Raleigh radiology, they are the two main radiology. Also cardinal radiology, cardinal
Yeah.
radiology. 3 of them are there. They all are giving you self-pay options, pretty cheap. I know at least till 2 years back, it was just $98 with Raleigh radiology and cardinal. Now I think it's $125 or something with wake radiology. I'm still referring for patients. They just have to pay a self-pay, and I'm sure we all can afford it. So if it is something, even if it is not covered, for now, no insurance is actually covering that, but it is good to get it done. So just, we go to one time, we go eat in restaurant, we're spending $200, $150 these days with the price of, everything going up. So
but
just
they said it is going to be like, they inject, some dye or something like that. That is what I'm a little bit concerned about it,
No, I don't think so. It's just a CT scan, just a plain CT scan. It just shows up on the coronary arteries if you have the calcium. So it's just a scoring. They just score the calcium. So just you can refer, and you can tell your doctor to send the referral. So you can actually check the price in all these 3 radiology centers, call them and see, ask them how much it is. It's all self-pay, and they also know patients are doing self-pay. See, whatever is cheaper, schedule a day and get it done. So it's a very simple test, nothing to worry about.
Okay.
மணி calcification டெஸ்ட் வேற, எம்ஆர்ஐ வேற. எம்ஆர்ஐ டை இன்ஜெக்ட் பண்றது வந்து அது வேற. அது வந்து ஆர்டரிஸை பார்க்கறது. கால்சிஃபிகேஷன் வந்து எவ்வளவு கால்சியம் இருக்குங்கிறத மட்டும் தான் பார்க்கறது. 2 தனித்தனியான டெஸ்ட்.
இல்ல, இது எம்ஆர்ஐக்கு சொல்லிருக்காங்க. எம்ஆர்ஐல ஒன்னு இருக்கு அப்படிங்க.
இல்ல இது சிடி ஸ்கேன்.
சிடி ஸ்கேன்.
It's called as a CT.
எம்ஆர்ஐ ஆஞ்சியோங்கிறது அது வேற, அது தனியா, அது ரொம்ப இன்வால்வ்டு, அது வேற டெஸ்ட். Okay.
So அது வந்து நீங்க cardiology கிட்ட போய், if they think you need an angiogram to go inside and look in your arteries, that is another test. That is a big test. It's an invasive procedure. They go in and check your coronary arteries. அப்புறம் blockage இருந்தா they put in a stent. So அதுதான் stent இருக்குன்னு சொல்றது. If they find if arteries are blocked greater than 60-70%, 60% more than that, they go and put in a stent to keep the arteries opened up, because it's blocked now, right? So they put something to keep it open. So that is, then if they see a lot of blockages, multiple vessels blockages, is when they do the bypass surgery. So those are the things you need to understand, like what is bypass.
So it's better we can do that preventive for that.
Yes, it's preventive test. It's very good to get it done. So those are all the cardiac screening test for make sure there's no blockage in your heart. It's better to get it done.
Okay, I want to say one thing. The word cancer should not cause death right away. There are a lot of treatments available now. Cancer of esophagus, ovarian cancer, almost cure mari varudhu. They have found medicines, oncology treatment.
Yeah, இந்த கொஸ்டின் தான் என்னோட செகண்ட் கொஸ்டின் கேட்கலான்னு இருந்தேன். சொல்லுங்க, நீங்க கேளுங்க.
நிறைய கேன்சர் we have treatment that was not available 10 years ago. People are living long time, so the word does not mean death. We have to be positive, we have to encourage and do the best we can. கேளுங்க மணி, என்ன கேளுங்க?
இல்ல, இப்போ ரீசெண்டா couple of my friends, past 5 to 10 years down the line, I have a lot of friends who died through cancer, pancreatic cancer and lung cancer and so on. But I know that I personally visited them, and then they suffered a lot, going through a lot of medication, a lot of chemotherapy, and they were the pain and suffering is very, very bad. On that situation, some of the critical, that means we know that it is going to be a fatality or anything like that, and then is it possible, can we stop the treatment, or because we don't know, that is going to be more painful, the new medications, all these things, I'm seeing that because of the medication.
Adala individual decision, money. We cannot comment on individual cases. Okay, thank you. Arul has been pushing me for this program for a long time, and finally it happened. Arul, your comment and vote of thanks.
Okay. Doctor, first off, எனக்கு 2-3 கேள்விகள் இருக்கு டாக்டர், but I have to say it was a very well presented, highly informative talk, so thanks for your time. அடுத்தது 3 questions டாக்டர். ஒன்று if you can throw some light on obesity. நான் அது கேட்கறது என்னன்னா, because that's ஒரு epidemic மாதிரி. So if you can talk, because there are people who do, அது South Asians கிட்ட ரொம்ப இல்லைனாலும்.
Why do you have to insult me like that? You should not insult me like that.
And so அதை பற்றி சொல்லணும். அடுத்தது இந்த probiotics, prebiotics, every it flashes on your face. நீங்கள் எந்த சோஷியல் மீடியாவில் போனாலும் you're always reading more about the prebiotics. So அதனால how much they say it's not only gut health, but the mental healthக்கும் it's very good. So that's another thing that I'd like you to talk about. And third thing, doctor, the நிறைய பேர் we travel to India, and then off late they say, அங்கெல்லாம் வந்து total body screening இருக்கு. Like all the different screenings that you talked about, but they keep saying that those things would definitely, try to be more on the preventative side. So on the total body screening, how effective is it? Or is it just a money-making gimmick that people say it's good that you do all those things, so you're kind of ahead of the game?
Yeah, so first question you asked about the obesity, right? Yeah, so that is increasing these days. Of course, and you must have heard about all these latest drugs, right? The GLP drugs, all this Wegovy, Ozempic, Mounjaro, and Zepbound, and all those things. It's very popular, and people are coming and asking me all the time, it's getting crazy. So main thing, as I said, those days, of course, you can always do it the natural way. I know it's hard. It needs a lot of discipline, the diet and exercise. So people are trying the shortcuts. Of course, the main thing is people sitting on the computers all day and, not getting physical activity. And then diet, so many things have changed in a diet with hormones and stuff, GMO diets and everything. So main thing, as I said, you can do the natural way. Second one, we have long-term medicines, like tablets are there, like, phentermine. Some patients use phentermine and all that. That still works. And Wegovy and all, it helps. I really wouldn't say that it doesn't help. I've seen patients lose a lot of weight. Even as soon as they start, within the first 2-3 months, it curbs the appetite. It reduces your cravings for food. It takes away the food noise, they say, constantly thinking like, I'm feeling hungry, and the thinking, a lot of it helps. So definitely it acts through the GLP hormones, and it is effective for some people. So
அதுக்கு side effects எல்லாம் கொஞ்சம் அதிகமா இருக்கு இல்லைங்க டாக்டர்?
Yeah, nausea or constipation. The way it acts is it slows down your bowels. So everything is slowed down. Definitely that causes some constipation for some people. Some patients even have vomiting. Long term is you lose some muscle mass. 60 to 70% is fat loss. 30 to 40% is some muscle mass. Also, you can lose. So yes, it does have some side effects also. Can you hear me? Hello?
Sure. Yeah.
Yeah, I think it just froze a little bit. Sorry. And the second question was about the probiotics and all that, right? So yes, so probiotics is really good for your gut health, and it's a good bacteria. So it's good to take your probiotics and make sure that your gut health is has the normal balance of bacteria, especially if you're taking antibiotics. It's good to take a probiotic with it. And yes, they say that the gut health and your mental health is connected. And in fact, now some study came out, the gut health and the autism and everything. So many things are going on, like the microbiome, they call it, of your gut is very important. So take it with the antibiotics, because antibiotics can wipe out your good bacteria. So we have good bacteria, bad bacteria. So you want to have some bacteria. There is bacteria in your gut, which is good for you, which produces all the necessary, digest your food and produces all the necessary minute hormones that you need and all that stuff. You asked about the full body screening, right, in India. So that
One question, doctor.
I don't know how often. I don't know if they have any guidelines, like you can only do it like so many years and all that.
Are you there, doctor?
உங்களுக்கு கொஞ்சம் விட்டு விட்டு விட்டுது. பரவாயில்ல. அருள் என்னம்மா வேற என்ன கேட்டா?
இல்ல இதுதான் கேட்டேன். பட் டாக்டரோட ஸ்கிரீன் வந்து ஃப்ரீஸ் ஆன மாதிரி இருக்கு.
டோட்டல் பாடி ஸ்கேன் வந்து இட்ஸ் a scam, but people like it, so it's done cheaper in India.
Exactly.
தமிழ்நாட்டில் சீப்பாக இருக்குது, அதனால யாரை கேட்டாலும் டோட்டல் பாடி ஸ்கேன் பண்ணேங்கிறாங்க. அண்ட் தே ஆல்சோ கிவ் அ ரிப்போர்ட், மைல் லாங் ரிப்போர்ட். தலையிலேருந்து கால் வரைக்கும் எத்தனை முடி இருக்குது, எத்தனை நகம் இருக்குது, எல்லாம் அதெல்லாம் ரிப்போர்ட்டில் இருக்கும். அதெல்லாம் வெதர் இட் இஸ் யூஸ்ஃபுல் ஆர் நாட் வி டோன்ட் நோ. டாக்டர், உங்கள் கமெண்ட் என்ன? டோட்டல் பாடி ஸ்கேன் ஊரில் போனால் சீப்பாக செய்கிறாங்க. இஸ் இட் குட் டு ஹேவ் இட் டன் ஆர் நோ?
No, I think it causes more anxiety, causes more unnecessary testing. Chumma or cyst kidney or cyst liver or cyst, which is pretty common for people to have. Then people start worrying about it. They want to get more testing, like MRI, aprom biopsy panna. Okay, then you start losing your sleep. So it's not actually necessary. So you can get mammograms and certain testing done. A full body scan, I don't think it's needed at this point. None of the medical organizations recommend the full body scans. So
going back to the gut bacteria thing, doctor, there's a lot of exaggerated claims when you see, obviously the industry is trying to push for more supplements and stuff for weight loss. That's like a big catchy thing. Everybody wants to look trim and so they are like, oh, take it, you're going to lose all these 20 pounds, 30 pounds. Is it like இதெல்லாம் என்ன just marketing இல்லனா உங்களுக்கு is there any truth to it that good gut bacteria helps aid weight loss?
I don't think it really helps with weight loss. It helps with it to kind of regulate your bacterial biome in the gut, and especially it increases the good bacteria. As you said, that yogurt, curd, it has a lot of good bacteria, the probiotics. Sir, நீங்க உங்க comment, sir, our sir the gastroenterologist.
I think eating yogurt is very good. All the probiotic, you get a benefit from eating yogurt. நம்ம ஊரில் தயிர் சாதம் இல்லாமல் சாப்பாடே கிடையாது. ஸோ அதனால தயிர் தான் பெஸ்ட்டு. மற்றதெல்லாம் சும்மா வேஸ்ட் ஆஃப் மணி as far as I'm concerned. But it is important. But people are realizing more and more how the small bowel works. There are a lot of things going on in small bowel that we do not understand. It has its own brain system. It has its own allergy system. There are so many things coming out now on small bowel. That is where the probiotic thing is really helpful. Bottom line if you take தயிர் சாப்பிட்டா, yogurt சாப்பிட்டா, that's enough. That's all. That puts an answer to all the questions. Thank you. The next common problem we all have is reflux esophagitis, heartburn. When I eat pizza, I have to have a pizza once a week. If I eat pizza, then I have to take a medicine. That's normal. When my patients come and say they have heartburn, I say, if you don't have heartburn, you are not eating right in America. So all the good stuff you like, it gives you heartburn. There's nothing to worry except when it happens for a long time, especially night time, the acid comes into the esophagus and irritates the mucosa. It can turn into Barrett's, and Barrett turn into cancer. அதுக்கு தான் எண்டாஸ்கோபி பண்ணுவாங்க. But that is being overdone all over. Common things you should not eat late. 10 மணிக்கு படுத்தா 8 மணிக்கு அப்புறம் சாப்பிடக்கூடாது. Coffee, alcohol, aspirin, cigarette, and I say mother-in-law, that is stress. These are bad for reflux esophagitis. We have to keep in mind, it's a preventable disease. A lot of people get excited and worry about cancer. The cancer is very, very rare. You don't have to worry about it every day. But you have to take care of it and do endoscopy every 3 to 5 years, something like that. Okay, Ma. That's enough. Arul, say a vote of thanks and then we can finish. Ilamaran, anything else? Okay, go ahead, Arul, please. Vote of thanks.
Definitely a heartfelt thanks, Doctor, for your time, especially. As I told you earlier, like it's an excellent presentation. It's not easy trying to put everything in a small capsule, no pun intended, but I think you just put a wealth of information, and we'll definitely do our part in trying to circulate it amongst friends, so everyone benefits. You are absolutely right at the beginning when you said it's healthy body, healthy mind, and we need the two work hand in hand. So, with all the right guidance, I think we should all be able to, and with all the technology in place, Dr. Ilangovan Anna சொன்ன மாதிரி, there's no need in this day and age for people, so many things can be prevented. So, எப்பயும் சொல்ற மாதிரி தான், நோயற்ற வாழ்வே குறைவற்ற செல்வம்னு. So, அதோட health is wealth. So, with that said, we're looking forward to seeing and hearing more of your, more in its other specialized talks down the road. But thank you so much for your time, and thank you all for coming.
Thank you for having
Nandri.
One last comment and then your final say, Doctor.
Thank you so much.
We all have to think about meditation. See, whether you are a genius or an idiot, you get 20% of blood supply to the brain. But the brain needs some rest too. And the only way brain gets rest is meditation, other than medicines. Meditation is good. Harvard has a very good program of total body scan, which relaxes the whole body and the brain. We all should start practicing meditation for our own good. Thank you. Doctor, your final comment and say bye. Sujatha, final comment.
Okay. Thank you very much for having me today and for giving this opportunity. It was really nice to talk to all of you and to share, whatever I know in the medical field. And thank you for Dr. Ilangovan for also participating and sharing in and giving your comments. So we can do more sessions. And of course, Tamiliyum பேசலாம் ஒரு நாள் எப்பனா if you guys, want one session in Tamil. So people who are more comfortable in Tamil can also, understand. And I think we're doing one session in FETNA also. So we are talking more to the public. So before it was more geared towards medical people. I think this time we are going to be talking more for the public. So hope you all can come and enjoy that session also. Thank you very much again.
Thank you all very much. Please post the YouTube in your email or whatever, WhatsApp, whatever it is, so a lot of people can benefit.